Welcome back to the PFC podcast. The views and opinions you are about to hear are the speakers and do not necessarily reflect those of anyone else. Now on to the podcast.
Welcome back to the PFC podcast. This is Dennis, and today I'm with Aryna. How are you doing today?
I'm great, thank you.
Hey, very good. Since this is the first time on on our podcast, would you mind doing a quick introduction of yourself?
Sure. So my name is Aryna. My call sign is Anchos, and I'm in tactical medicine already 4 years. So I was an instructor of tactical medicine in 2022. Then I joined the battalion of medical evacuation hospitalers, and I was working there for 1.5 years. And then I just joined regularly army, and I just continue to do my job. I just do medical evacuation stuff, and yeah, that's all.
Oh, okay, very good. So are you doing the actual evacuations, or are you still training others to do it?
So usually, like most of my job is just medical evacuation, but sometimes I just need to be an instructor. I don't like this kind of job, but it's just we don't have enough people to be just instructors. So sometimes you just need to do it.
Okay, all right, very good. So if you could, like the Ukraine war is definitely changing a lot of people's minds about how things are going to happen in the future, and everybody's just trying to catch up, right? The medics on the front line, they used to, get medical training just like anybody else would, and now this war has very much truncated their education, their training, and preparation in order to go to the front. So essentially, it seems like it's going down to like 6 days, and now here's your aid bag, you're good to go. What kind of gear, what kind of things have changed, I guess, as far as their education to prepare the medics to hold on to a patient for, it seems like, a week?
Yeah, that's true. Actually, the war kind changes like every half a year, I guess. So it was kind of stable like the first year of war, but now like I was in polygon for several months, and I came back to combat zone, and I was like, wow, everything changes for this like several months, and that's why we need to change an education and gear and just approach everything like very very quickly and be very adaptive, and that's a huge work that we need to do. So from 2022, when the war just begins, I didn't work in combat that time, but I already worked with military a lot, and I know that usually we didn't have a lot of tactical medicine there. We just um, our evacuation process was just to take people in the truck and just go. And then just when you get to stabilization point, then they can help casualty with medical stuffs. Um, and yeah, a lot of changes from then because of the drones, as you said, we have a very long term to from the moment of being wounded and to the stabilization point. It can be like a week, it can be 2 weeks, it can be very long time. And now we have a big uh, we try in general, we try in our tactical medicine culture to more emphasize in the combat medics that's on the same positions, so they can take care about the casualty for long, or we can have a close positions where we can make a triage and to decide who will be evacuated firstly. So yeah, and if in 2022 we just learned people like just basic combat medics, just how to handle very like basic stuff like applying tourniquets, making like wound packing and other stuff as a ASM CLS level during the protocol TCCC. So now we need to teach combat medics how to make blood transfusion, how to uh, like handle like conversion of tourniquets. It's already like very basic thing. That's usually what we teach with a usual training of like about tourniquets. So combat medics just have much more responsibilities now, and they need to be more qualified, like in a like almost like more than CMC level. Yeah.
No, definitely. So as far as supplies that they bring with them, like like you probably can't bring an aid bag big enough to hold on to somebody for 2 weeks. So I guess how do they reconcile this?
So that's actually like a general problem. Again, I'm not I don't have a huge qualification about like combat medics because I work in vehicle. But anyway, they can have drone supply. So we really have not only our like enemy have a huge drone system, but we also. So we have this kind of drones that can deliver packages to their positions, and they usually have medical stuff. So it's much easier not just to carry it on the backpack, but also have like a drone delivery. Um, yeah, so they can have it. But also, as you know, it's very like that's popular, but very common thing that's not that's now like all people that goes to position they can have like small packages with medical stuff to help like a combat medic to carry it because that's just too much stuff. And maybe the most important and the most useful thing that we can like deliver with drones and also carry like in backpacks, it's like the kit for blood transfusion, just in the position. So you can take a blood from one guy and put it to another. So something like that. That's very useful. And like the organization that I was part of them in the 2022 when we taught military tactical medicine. They already do this kind of kit, and they like have a very great quality. So I used them several times in the combat zone, but yeah, I used them there and like Polish, I guess. And I can say that Ukrainian stuff is much more like much better quality.
Okay. Well, good. You got to take care of yourself, right? Obviously, you guys, I guess, when the soldiers are being like brought into the military, they're doing some kind of blood testing, blood typing.
Yeah.
Yeah. Okay. Are they doing O low titer or O negative blood, or are they doing type specific transfusions?
So we usually don't really trust these like patches with a blood type. So in this kit they have blood test. So Elgin cards.
They're doing the Eldon cards. Okay.
Yeah, because it's I don't know. A lot of people just they think that they have this type of blood, but they have another. Even if they had tests like just like months ago.
No, it is super common. It's even common in the U.S. Like the soldiers, their dog tags are incorrect, right? So obviously, before they push out to the front, they're getting their blood tested again, or are they doing it like in the trench, like doing those little Ellen cards?
Mm.
No, which one? Are they doing it before or when they need it? They're doing the Eldon cards.
Actually, both. Like, it really depends on brigade because we also have like very different like quality of brigades, if I can say so. And yeah, so in brigades where I served, yeah, we had both.
Okay, good. Um, Obviously, drones are a huge part of like the modern battlefield now, and Ukraine has been essentially at the forefront of it, just out of necessity, right? So, how has just the drones and drone warfare, how has it changed, and how have the medical evacuations had to change to keep pace with it?
Um, so yeah, as I said before, in the beginning of war, we didn't have um like good quality like Kazakh, like um yeah. So we still have this like Kazakh medevac stabilization point, and yeah, and I worked in Kazakh in the beginning of my military experience, and that was a car that was Nissan Navara that was changed, like just changed a little bit for having more space for casualty. But we didn't have any equipment there. We just had backpack with different medical stuff, and it was just you can go for evacuation like any moment. So you have a casualty. They send this information by radio, and you just go there in any time of a day, and you just try not to um, be under like artillery strike, something like that. But we didn't have problems with drones at all. And now we like a lot of brigades just don't have Kazakh at all because it's too dangerous. And like the role of Kazakh, it's just usual vehicle with protection, I can guess, and without like medics. Just to deliver a guy closer to like evacuation vehicle, and this evacuation like medevac now it's equipped with a lot of medical stuff inside, with a lot of like I don't know if it's popular in US, like saras or moops, saras moops.
Are you talking about the oxygen generators?
Yeah. So saras, yeah, it's I guess it's like almost in every vehicle. It's very popular here because they are very like small space. They take small space, and they're very useful in every like a difficult casualty. And also we have like very expensive stuff. Um, Let me think. SOC moves. So it's Canadian, like that take also very small stuff, but you have like a ventilator here, a monitor, also like oxygen concentrator, suction, um, what else? Like something else, and like a lot of different stuff in one thing. That's very useful, and that's just great, but it's too expensive to have it everywhere.
You're
So
talking about that. I forget the name of the company, but it's like 4 feet long, and it attaches to the litter.
Mm, not we did it. gadgets to whatever. It's just a vehicle, but yeah, it's just like 5 or 6 in one. So yeah, it's very useful because when you need all this stuff like in different equipments, it's again you don't have like enough space for other like medical equipment. um yeah, so yeah, equipment changed a lot through these years. What else? Yeah, the protection of vehicle as well. So as I said, when we had with some Nevada, so it was, we didn't have any protection. But now, like the last vehicle in which I worked, it was a huge vehicle with protection of, like, how do you call it? Like when you have like armor protection. I don't know.
Yeah, armor.
Yeah, also the steel net against the drones, because it can help like to spread the explosion. Uh, what else? This, we call it ramp. I guess you call it Joe or something like that. So it's something. So again, the drones that spread um, the radio waves.
You're talking like a jammer?
Jammer, yeah. And we also have one more person who is responsible for shooting drones. And yeah, so like a lot of stuff started to be more complicated. And on the one hand, it's better because we have like we can provide a better help to casualty, but the other stuff, we spend so much resources to do something against drones, because like it's a lot of them. And also we have like detectors that can detect like if drone near us. And that started to be very difficult. And that's annoying.
I mean, considering I'm willing to bet those roads are probably pretty rough. So those vehicles have got to be pretty robust. Because if you guys get stuck, like, it's going to be a bad day.
Yeah. And actually, like from my personal feelings, like it was much more, like we had much more fun like several years ago when it was like, we need to go for a casualty. Hey, yeah, that's like that's even interesting. But now you need to protect like everything, and it's yeah, difficult.
A lot of planning, I'm sure.
Yeah.
Now, earlier, maybe a year or two ago, night vision or thermal drones were not nearly as common. So essentially, you could evacuate at night, and at least you had that cover of darkness, at least from drones, anyway. And now, technology evolves very quickly. So now, like, is any time of the day better than another, or is it all the same?
Yeah, so usually evacuation goes like at night, but it's more it really depends, but usually at night, because it's much easier. So the first stage of evacuation that goes before us, because medical vehicle, that's usually either just a vehicle that do like change of soldiers stuff, or like the drones that goes by the land. Like I'm not sure how to call it, but um, and yeah, and they need it's better for them to go during the dark period of the day. So yeah.
Yeah, speaking of drones, the evacuation drones, are those getting to be more common? Where the ground vehicle comes up and they load the guy in and then it turns around and goes back? Is that getting more common?
Yeah, sure. So I remember how like couple of years ago we just laughing when we heard about these kinds of drones because like it seems to be like very um like something that's not going to work. But now we have like it's one of the most effective, I guess, kind of evacuation from the compositions because uh, because they just you don't need to risk like other people to evacuate a person who already wounded. So yeah, and like my previous brigade, they had this kind of drones with protected capsule, so it was like this armor protection. So if they hit it by another drone, by FPV, for example, um, it can be okay for him. So this kind of work, and that's why it's much more popular now. And yeah, as I know, Russians have them as well, but in less amount because they just care less about their patients. I don't know. They have more people and they can like afford not to take care about like casualties. Yeah. But it's much more popular in Ukraine than it was like a couple of years ago.
I guess any other real major changes as far as gear goes before we get into like the blood transfusion?
Mm, Let me think. So yeah, equipment and vehicle, I guess it's the most.
Yeah, I mean, it sounds like you've gotten a lot more gear, a lot more protection when it comes to evacuation vehicles.
Okay, yeah, and so we talked before about the like equipment, like body equipment that covers a lot of like parts of the body. Um, so it can work because yeah, we have more like shrapnel wounds. Um, but it really depends on what's your role on the like positions or movement like between positions or something like that, because now the danger zone is much bigger. So it's not just like positions are in danger, but also like the main cities that are near the front line. So it can be like 20, 30 kilometers of danger zone because the distance that drones can like achieve. So yeah, it doesn't matter if you're like medic or you're a shooter or you can be anyone, but you're in very big danger, bigger than when it was just artillery danger. So yeah, and how many protection you have on your body, it really depends on your role, because when you need a big mobility, when you need to move a lot, for example, like assault groups or um, like people who just like drivers as well, um, it can be like it can make even worse because just a small shrapnel that like wounded you, it can be healed, but when you're not like don't have enough speed to move from drones, for example, or to move from enemy, it can be like worse for you. So it's as usual, you can just need to balance pros and cons. Also stuff.
So, what she's talking about is, um, I had mentioned I had seen a video of they're adding soft armor to more places like the shoulders, the groin, the abdomen, the thighs, the lower legs, the upper arms, the lower portion of the arm. just essentially you have like this suit of armor, of soft armor, with your vest and plates on top of that, just to have more protection from shrapnel, low velocity shrapnel injuries.
So you mean like a pants with Kevlar, right? Like a Ubex with Kevlar? Yeah. Yeah. I know. Like I wouldn't say it's very popular among people who I met on the like army. Uh, Maybe just because it's very expensive and we don't have like a huge salaries to cover it. So
Obviously, like in there, yeah, I've even seen like this great big neck protection. So obviously, there's got to be a balance between maneuverability and protection, right? Of all those options, I guess for armor, what have you seen be most effective at like saving a dude's life? Like I'm guessing protecting the neck is a big one. Protecting the abdomen is another one. Do you see a lot of people wearing the arms and the leg armor?
no, I actually honestly I see a lot of people who doesn't wear even like general body armor just because their back is hurt. So yeah, and it's just like when you're in a like more than for a long, you just your brain like tend to decrease the like danger understanding, and that's why I guess. But yeah, I saw some people with legs and arms protection, but that's very like not popular. Um, so neck protection is much better, and that's like part of the body armor that like um just army give us like um free. So it's very basic um protection. Yeah, and it's kind of useful. And I had several patients who was alive uh, just because they had it. So yeah. So I guess neck is the most like except the usual plate carrier and helmets, obviously. Next, like next priority is neck protection.
So on the blood transfusions. So obviously right now, blood transfusions very popular. It seems like most places in the world, but it wasn't always like that. And I know definitely at the beginning of the war, blood transfusions and the ability to transfuse blood pre-hospital anyway, like was not supported. So since you've been there through the entire transition, like I guess how did this happen that you're now able to do these transfusions almost, it sounds like, pretty freely?
Uh, yeah, like mm, most of the problems, I guess, that we have in Ukrainian tactical medicine is like it's all about money, and the blood transfusion is very expensive, and that's why we had like we have problems with it. I mean, in like why it's not as common used as it should be. But we also have a lot of people who really against it, and like obviously in the beginning of war we just didn't have resources and didn't have understanding how important to give blood, but not crystalloids. And yeah, but thanks God we have a lot of people who care and who do like in a volunteering way, and providing a lot of like education in this topic. And yeah, so now in a like cool brigades, as I said before, like we have like better brigades. Um, Almost everybody has the fridge for blood, the uh, like blood how to call it, called chain, cold chain blood,
Cold chain.
something like that.
Yeah.
Yeah, and they can provide like a blood, the units of blood. Others who doesn't have it just try to make a transfusion from a like walked blood bank. Do you call it like this?
Yeah. Walking blood bank.
So, yeah, walking blood bank. Yeah, and yeah, so it, like it was developed by the people who care, and now we have a lot of educational programs on that. And I guess I forgot your question. Sorry. Can you remind me?
Very early blood transfusions were not common, right? And it seemed like even like the minister of health and like just it was like a big political problem. And finally, now currently, if you at least have the gear, like you're allowed to do it. And that's an issue all over Europe as far as blood transfusions. Should that only be allowed with doctors, medical providers, or should we let military medics who have some kind of training do that? And it seemed like Ukraine has definitely made that transition.
Yeah, as I know, now we have like this. So the Ministry of Health and Ministry um, of how did you call it? So the government, yeah, allowed us to make blood transfusion for people who doesn't have medical education, and but just like in a case if you have like certificate that allows you, and this certificate is very difficult um, to have. But anyway, it's a great victory for everybody who in this who everybody who um, for like blood transfusion, and we had like year or 2 years ago, I don't remember exactly, but the first case when we had blood transfusion from the unit of blood in the trenches. It was from the Brigade Azov. And so they were first who made it and who could like save a person just like having resources and having uh, like a person who know how to do it just in trenches. So we usually think about like combat medics as a like very as a people with very basic medical education, with very basic training, and when they proved that this is that's possible, it just I think it's something it changed a lot in minds like of a lot of people, because when I have arguments about blood transfusion, I always have it as a proof that like it can save lives and it's influence on a lot. So yeah, and from that time the blood transfusion on the evacuation vehicle started to be more popular, and not just from hospital to hospital, but also from like Kazovac, from like Medevac, and closer to the front line. And especially when we have a situation when a lot of casualties had uh, um, had a had been wounded for a while before they come to us, um, it really can save, because even a small wound and even a small amount of blood that you just continuously um, mm, lost, lost. uh, yeah, and blood transfusion can help a lot. So yeah.
And that kind of leads into just the prolonged field care. Like you mentioned, some of these evacuations, days, weeks long. Obviously, if this person was going to bleed to death, I can't imagine that there's enough blood kits to keep somebody around for weeks doing that. What other trainings, how are these medics in a trench with very little equipment? Yes, they can have drone resupply, but they can keep a guy around for, a week, 2 weeks. Like, how are they getting this done?
So usually for the huge amount of responsibility here is on the communication, because like when you're on position and your like comrade was just wounded, it's very important how you provide this information to commanders, so they can decide like how long you can be there, or how like critical the evacuation now. And of course, like if the tactical situation is okay for evacuation by drones, for example, or by like uh, any kind of vehicle that is gonna be in this area. So it depends like how hard you've been wounded. So if it's something critical with like brain damaged, or with a like a huge hemorrhage, and you're not evacuated like from the first hours or day, so obviously it's just impossible to remain the patient in the like trenches in a good condition. But most of the casualties that were transported like during the week or two, they were infected, of course, and they had worms um, in their wounds, and this is very common situation now. And we also have in stabilization points the separated room for like infected casualties. It's usually for people who like 2 more days on the with a wound, and this room is more like common used, just because we had too much casualties that was wounded for a while. And yeah, so the one more skill that is important for medical for combat medics, for medics of evacuation, is cleaning the wound. It wasn't like necessary before, because we just like didn't have a lot of patients who can wounded for a while. So yeah, cleaning the wound, and also to uh, like monitoring the patient for a long time. This can be very difficult skill, because you need to manage a lot of stuff, and still think about patients and how his vital sign changed. And also you need to think how to help the person to do his very basic stuff, like can he eat like by himself, or you need to give him something very uh, can he like swallow, and something like that. And how is he going to be um, to go to toilets if like he had 2 tourniquets on his leg or something like that. So very basic stuff. And all the medical um, interventions that you did to your patient, like is it comfortable for him, like the catheter, not catheter, cannulas, IV cannulas can be on the like, if it's um it can be on this parts of I forgot, on the elbow, right? And so he can have he can just sorry, I forgot all words.
Like this, are you talking about the cath? He bends his arm and it kinks the catheter off? Yeah.
Yeah, and you can think like why like casualty feeling worse, but he just took his arm like that, and your infusion just stopped, and like a lot of like very basic thing that usually you didn't care about on evacuation, or you didn't care about like in pre-hospital care. They can you just need to start to think in different way, just because it's a not just urgent situation. You just need to um, think about it in a long time, and that can be very challenging. Yeah.
And not to mention, you have to think about your own survival. Like there's still drones hunting you. There's still artillery barrages. There's still action on the front, right? So definitely a very, very dynamic situation. Just trying to maintain somebody that's wounded till we can get some kind of evacuation coming back.
Yeah, that's true.
Awesome. When it comes to like evacuations and how things have evolved over time, is there anything else you'd like to add?
I just, as I said before, just like everything started to be very difficult with like your own protection and your own safety, and that's actually very um, like when I just started to do all this stuff, I just was care more about like casualties, not about me. And yeah, I think like a lot of medics on evacuation feel the same, that it's very unusual to think more about yourself, just to care about your casualty. But as we remember, it's the first rule of any kind of help, and especially in TCCC protocol, like your safety is the first priority, because you can help to a casualty only when you save. So yeah.
Absolutely. Well, thank you, Aryna. I really appreciate you jumping on.
Thank you. It was very interesting.
That's it for today's podcast. Make sure to go to our website, www.prolongedfieldcare.org. Check out our free downloads and a ton of other helpful information. Grab a bag of our fresh roasted PFC coffee, links in the description below, and stay on the bleeding edge of combat and austere medicine. This is Dennis for the PFC podcast. Out.